Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
Welcome to The Explainer. Today, we're going to tackle a really complex term, emotional behavioral disorder. Our goal here is to cut through the jargon and just get some real clarity for parents, teachers, really for anyone who's trying to support a child through some tough emotional and behavioral challenges. Okay, so here's how we're going to break this all down. We're going to start with the basics, what even is EBD? Then we'll get into how schools and doctors see it differently. From there, we'll talk about getting the right support, knowing when it's time to take action, and finally, how to plan for the future.
All right, first things first, let's get a handle on what we're actually talking about when we use this acronym, EBD.
So this is super important to get right from the start. EBD is not a specific diagnosis you get from a doctor, like ADHD or depression. Think of it more like a big umbrella term, a descriptive category that's often used in schools to describe a pattern of difficulties that are getting in the way of a kid's ability to learn and connect with others.
And what's really fascinating is how these challenges can show up in two very different ways. On one side, you have these internalizing patterns, things that are directed inward. We're talking anxiety, withdrawal, things that can be really quiet and easy to miss. But on the other side, you have the externalizing patterns, the stuff directed outward, like defiance or big emotional outbursts, which tend to be a lot more visible and disruptive.
And this is where that umbrella visual really comes in handy. Underneath that big EBD category, you can find a whole range of specific clinical conditions, things like oppositional defiant disorder, various mood and anxiety disorders, and others. It just shows you how broad this category is and why a one-size-fits-all approach is never going to work.
Okay, next up is a distinction that is absolutely crucial to understand. It's how schools and doctors look at the very same child's challenges through two completely different lenses, and knowing which lens is being used is key.
And it all boils down to this one simple but powerful idea. The words we use, the labels that are applied, matter so much because they are literally the key that unlocks access to support, whether that's an IEP in a school or therapy from a clinic.
So, when you're in a school setting, the legal term you'll probably hear is emotional disturbance, and the school team is laser-focused on one big question. Is this getting in the way of the child's education? Is it impacting their ability to learn, to build relationships, to function at school? That's their primary concern.
But then you have the clinical lens. A therapist or a psychiatrist, well, they're not thinking about school eligibility. Their job is to figure out if there's a specific underlying diagnosis, like an anxiety disorder or DMDD, that can guide a very precise plan for treatment. Two different goals, two different lenses.
So once a need is identified, what happens next? What does help actually look like? Well, the good news is that support isn't just a shot in the dark. It's carefully designed to match a child's specific needs.
And we can think about that support in three basic tiers. You start with lower intensity, foundational stuff, like new strategies in the classroom or coaching for parents. Then, if that's not enough, you might move to moderate support, like outpatient therapy. And only when it's really necessary do you escalate to higher intensity, more comprehensive care. And we know from a ton of research that different tools work for different problems. For instance, cognitive behavioral therapy, or CBT, works wonders for those internalizing symptoms like anxiety. But for more disruptive, externalizing behaviors, something like parent management training is often the gold standard. It's all about matching the strategy to the struggle.
And I just want to be really clear here. Those higher intensity options, like residential programs, they are reserved for situations where safety has become a major concern, and other, less intensive approaches just haven't been enough to manage the risk.
So, this leads us to a question that I know so many caregivers and teachers wrestle with. When does concern cross the line into needing a formal evaluation? When is it time to act?
It's a tough question, right? So let's walk through a pretty clear checklist that can really help you figure that out.
You got to ask yourself a few things. First, has this been going on for a while, like several months, and in more than one place, like at home and at school? Is it actually getting in the way of learning or friendships? And the big one, is there a safety risk, either to the child or to others? If you're nodding yes, especially to those last two, it is absolutely time to seek a formal evaluation.
And one of the most powerful things you can do right now is to start a simple behavioral log. Just writing down the what, when, where, and why.
This isn't just a diary. It turns your general worries into concrete data, and that data is absolutely invaluable for any professional you talk to.
All right, our last section, let's talk about the future. Because that's really what this is all about, right? Acting early has such a profound, positive impact on where a child ends up down the road. And look, the evidence on this is just undeniable. Getting the right support at the right time dramatically changes a child's life trajectory. It helps them build coping skills, it protects their relationships, and it sets them up for long-term success and independence.
But that support can't just stop at the high school doors. For teenagers especially, it is absolutely essential to start planning for that transition into adulthood long before they graduate.
And a successful transition really hinges on a few key things: making sure school goals connect to real-world life skills, ensuring there's no gap in mental health care, and using all that great documentation to get accommodations in college or at a job. These steps are what prevent kids from falling through the cracks.
So, if there is one thing to take away from all of this, it's this right here. The simple act of seeking clarity, of trying to truly understand what's going on, is the first and most critical step. It's what leads to the right help, and ultimately, to better outcomes for kids.
And that leaves all of us with a pretty big and vital question to think about. How do we, as a community, shift from just reacting to crises to actually building systems that support kids proactively before they're in crisis? It's a huge challenge, but it's one we all need to consider.
So if you're sitting there thinking, okay, what do I do now? The resources from our source material at Cenario are a fantastic place to start. They've got plain language guides and even a short screening quiz that can help you figure out your next steps with a little more clarity and confidence.
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.